tell, we've done a press release. King County has done a press release. And what we are all talking about is an event of COVID transmission in wrestling tournaments. Now, we know historically wrestling tournaments tend to have outbreaks associated with them. Back in 2017, we had an outbreak of pertussis in some of the very similar events we're talking about today. So I want to remind you, we're in the very early stages of this outbreak investigation. It is ongoing, and things we talk about right now will be changed the minute we get off the phone. So numbers will change and totals will change. So I just want to reiterate what the press release said from DOH, that there were between 80 to 90 patients at this time. So people that were attending these wrestling events that actually had COVID. The late breaking news from this that we've got in the last hour is that 3 of those, not necessarily all that will come from this, have been identified as the Omicron variant. So we clearly have increased transmission due to this variant. And unfortunately, there's at least another 10 with S dropout, which is an early indicator that this is Omicron. For many of these events. And so with that, I don't want to belabor this. A lot of this was in the press release. I think we should just open up for questions because we really only have till about 1 o'clock. Julie, I could probably do an extra 5 minutes past 1, but then that's my hard and fast.
Got it. All right, we'll open it up for questions.
Dr. Lindquist, it's Dee Dee here with Cairo 7. Do you have any idea about how many of the people who are impacted, who are sick, have been vaccinated versus not vaccinated? And are all the people who are impacted, are they all students, or are there also, participants who are included in this number?
Yeah, unfortunately, we have not got a lot of information. The way this works is we identify a positive case. The local health jurisdiction calls and interviews the positive case. And so that's why our numbers, I guarantee by 4 o'clock this afternoon, we'll have quite a few more. As these local health jurisdictions, there's 11 of them that are interviewing the patients within their counties. They will then notify DOH through our electronic data system, it's called WDRS, of all the details of vaccination, symptoms, test dates, all these details. In the meantime, though, we don't sit around waiting for those. We do get these. I asked all the counties to send 3 to 5 samples from each of the counties of these outbreaks so we could see if there was a role for Omicron here. So I am not surprised to see that Omicron has been verified in these very early samples. But unfortunately, the clinical data you're asking me about is not all in yet.
Hi, Dr. Lindquist. This is Amanda from the Seattle Times. I have a question about the tournaments. Is there any indication that they were following current guidelines when it comes to masking and testing athletes who are vaccinated and unvaccinated?
Yeah, so there's clearly guidance for events like this. And the question is, with this new variant, is that going to be enough? And so we at DOH and the local health jurisdictions are really putting our heads together today to come up with some recommendations that we have universally across all these different health jurisdictions. You'll see some of the health jurisdictions already trickling out with some recommendations. But I'll be honest, I looked at some of the pictures and videos of this event, and there were a ton of people in indoor spaces, crowded into bleachers, not wearing masks. So I can say very clearly, no, the guidance was not being followed. And we would really hope at this point, anyone who is at one of these events, because the transmission is so likely with this new variant, in the scenarios that I saw in actual photographs, that people should get tested at this point. And it's a good reminder to all of us going to public events. In indoor arenas, we really ought to be wearing masks and doing some social distancing.
Dr. Lindquist, John Ryan from KUOW. Can you just spell out what are the guidances or requirements for COVID safety at these tournaments like these wrestling tournaments? And just maybe personally, do you think holding a tournament of wrestling is a good idea at all in a pandemic.
Yeah, so let me go backwards from your questions. There are things, it's just like driving a car, right? We let our teenagers get in cars and we drive them. Is it completely safe? Absolutely not. But there are things that we can do to help mitigate the risk. Like when my kids are teenagers, I didn't really like them driving at night. I made sure they were in a car that had a safety rating. I made sure they wore their seat belts. So very similar guidance for things like high-risk contact sports are part of the state guidance, and that is testing before these events, especially unvaccinated folks. So the question, though, with a new emergence of Omicron, which can infect both those who have had COVID before or been vaccinated or unvaccinated, do we need to change our guidance? And so that is something we're talking about today pretty intensely. Even though the guidance right now doesn't recommend testing all persons that communicate. There is indoor masking guidance that is very clear, very separate from all this, especially if it's held in certain counties that have even more stringent requirements for indoor masking. So those things are in place. And I think you hit the nail on the head here. Is this something that we should really consider is not a safe event anymore, and during what is now clearly an Omicron outbreak, and that's what we're all deciding on. I don't have any recommendations for that as we speak right now, because there's lots of health jurisdictions involved, lots of staff at Department of Health, and we need to come together very quickly on some recommendations for the state.
Hello, Dr. Lindquist. Jennifer Lee here with Fox 13. Thank you so much for taking questions today. My question is, do we know how many schools could be impacted, and will there be further steps taken based on, how many students were infected, maybe their classmates, and the contact tracing that might have to go into an outbreak of this size and scope?
Yeah, Jennifer, great question. You would be great to be on this investigation team, because that's exactly what they're doing right now. It's finding out how many schools were actually involved. In our press release, we released the events that we knew about. Since then, quite a few more events and schools have been identified. So I'm going to have to put a pause on that to say, hey, look, we're gathering that information right now, and it is going to be more than what we initially were aware of. And we are also going to see the numbers of positive spectators and participants increase over the next 12 to 24 hours.
Dr. Lindquist, it's Dee Dee again with Cairo 7. I know that the Tacoma School District put out a statement last night saying that because of the situation, the DOH has asked all wrestling programs be halted. And until we receive further direction from the Department of Health, we will not know the exact date we can return. Has the DOH asked all wrestling programs to be halted?
Yeah, not to put too fine of a point on this, that is incorrect statement. DOH has not made that recommendation. And quite honestly, we are in communication with all 11 at this point, local health jurisdictions and the governor's office to make recommendations about what we recommend. I am not quite sure. I heard that same thing coming out of Tacoma, but that was not anything anybody at DOH made a statement about or a recommendation. There are several counties that are reaching out to their schools, and that's probably the biggest reason we all need to be on the same page and have common recommendations. In the state of Washington, when an outbreak goes across county lines, so it isn't just King or Snohomish, but it's multiple counties, then DOH is the entity in charge of this. And we have not made that statement.
Thank you for clarifying that.
Can you clarify what you mean by more events have been identified?
Yeah, so we know with our experience, ooh, that was my phone that just dropped, ouch. We know with these events that as we dig deeper into them, we hear about other wrestling events or tournaments, both in the past that are planned. And as we are doing these interviews, we're finding my staff that's on the front line of this investigation, this ongoing investigation, alerted me right before we started this call that there's going to be quite a few more events that have been found to either have happened or being planned for the future. That's what I mean.
Hey, Dr. Lindquist, this is Tammy Matassa over at Como. Thank you so much for your time, as always. My question is, what, at this point in the pandemic, what should we be learning about this outbreak?
Yeah, I think everything we need to know, we already know. There is no question that getting vaccinated, while it may not be perfect, is one of our best strategies for controlling both the Delta variant and to some extent the Omicron. We don't understand how much Omicron is going to respond to the vaccination because clearly we're going to have people that were vaccinated that get cases, as well as people that were previously infected, as well as people that have not been vaccinated or infected. And so as we gather more experience about who's the most at risk here for spreading this within the community, I'll let you know. But we do know that vaccine definitely will not make you more opportune for this infection. So it still remains a cornerstone of prevention, as well as masks. Doesn't matter what the variant is with a mask. If you're properly wearing a mask, it had some protection against any variant. So it's kind of getting to be an old story. And I really feel for people because I know they're tired of hearing this. I'm tired of it. I diagnosed the first case in the United States with our team here in Washington State. So no one has been at this longer than we have. And I understand it's very tiresome. It's very tiresome to put on a mask every time you go in the grocery store or an indoor space. But those are the things that we know help prevent the spread of infection. Obviously, very common sense things like don't go to crowded events. And if you do go to these crowded events, especially if they're indoors, then we should be wearing masks and really maintaining a distance. The other thing is if you're symptomatic, you need to get tested. I would really recommend if you were in one of these events that you get tested anyways, now that they've had a couple days past these events, but certainly if you're symptomatic. And if you're symptomatic, please don't go to school. Please don't go to work. Because if you tend to turn out to be positive, you just exposed a whole nother group of people that hadn't gone to the wrestling tournaments. So these are the things that we already know that can help control. It's not going to prevent any ongoing transmission, but it is certainly going to help control the impact of this. And it's very disturbing to me that we've now identified Omicron as one of the variants involved in this outbreak.
Just to follow up, I'm still not clear what you mean by more events. Are we talking more wrestling tournaments? Are we talking more sports events? Are we just more outbreak events of all sorts of things? What are we talking about?
We are talking about more wrestling events have been identified.
Thank you.
Dr. Lindquist, this is Jeff Graham with the Kitsap Sun, longtime sports reporter here. I'm wondering about, an event that's kind of usually planned for every February, Mac Classic at the Tacoma Dome, probably one of the largest sporting events in the state. I'm wondering if we're kind of trending in a direction where such an event just might not be possible with kind of where we're headed. I don't know if you can speak on that at all.
Yeah, I mean, Jeff, that's exactly what we're meeting with all the health jurisdictions in the governor's office about is it doesn't look good right now. Okay, it doesn't look good, the sheer number of people that were infected. It doesn't look good, the transmission opportunities in a wrestling match, especially when people are crowded in indoor spaces and not wearing masks, that this does not bode well. And really the icing on this cake today is that these are turning out to be at least some percentage of these Omicron variants that are much, much more infectious. So all this will get weighed into what the public health system, the athletic system, the governor's office, what we all weigh into recommendations for the state. So unfortunately, we're doing this at 12:45, and a lot of these meetings will be happening after this event.
Dr. Lindquist, I have a question from KNKX. They would like to know, is this considered a large outbreak, extra large, medium sized, et cetera? What level of alarm should we be at?
Yeah, so there's a couple of ways to look at this. The very obvious and blunt response is we're in the midst of a pandemic. This is a pandemic. So yes, we should be alarmed. But even if we weren't in a pandemic and we had an outbreak this size, this early, this would be considered a very large outbreak.
Can you clarify how many total participants there were between the four tournaments?
Yeah, you know, I don't have that at my fingertips, Amanda, right now. But those numbers, like I said, as we're adding other events, those numbers are changing minute by minute. And the case counts that we initially are looking at, confirmed cases, was in the range of 85 cases. So, excuse me, it will be much clearer probably in about 24 hours what the total number of events are, the total number of people at risk, and a clear counting of the cases from the local health jurisdictions over the next 24 hours.
Bethany from WSU Vancouver Student News Magazine is asking, should public universities holding in-person classes begin to implement further restrictions or risk spreading the variant?
Yeah, there's currently no guidance from the CDC or from the state for that at this point, but stay tuned because as we see the impacts of Omicron in the state, we may change recommendations. The thing going in our favor right now is we're coming up very close to winter break. That will help interrupt some transmission in school settings or sports settings, but then it really becomes the onus of us as individuals going to family events or parties to really help control the spread. And again, those recommendations are not anything new. It is get vaccinated, get your booster, wear a mask if it's an indoor space, or test before the events.
Dr. Lindquist, Dee Dee here with Cairo 7. I have a follow-up
Yeah.
to something you said earlier. So you mentioned that, you know, recommendation for wrestling will be discussed after this call. Do you anticipate recommendations for other sports might be changing as well?
Yeah, great question. That is part of the discussion. And I want you to think that these discussions are going to start after this meeting. They've been going on since yesterday. Quite honestly, they've been going on over the weekend. But yeah, that is part of it, Dee Dee. Really, why would we just single out wrestling? Again, of course, everybody knows what wrestling is. It's intimate one-on-one contact, but also that whole crowded gym, indoor space, referees. What are all these recommendations for similar sports? As you can imagine, basketball, volleyball, other very close contact sports or high risk sports. The question is, do we need to change the guidance for those also?
As we learn more about Omicron and its transmissibility, would you be able to draw a parallel to, you know, this ongoing investigation and the outbreak to the weeks ahead and the months ahead in the state of Washington, and, you know, just kind of drawing caution from this incident?
Yeah, so we have a team of modelers that is looking at this. Unfortunately, there's not enough local Omicron data to help us do significant modeling, but that is exactly what we're trying to project. This does not bode well, you guys, to have an event so early in the appearance of Omicron in Washington State that already has these kids involved with positive cases with this new variant. So it doesn't look good, but we are trying to model the future on this as we get more information. Certainly this wrestling tournament outbreaks will help inform our modeling and what we can predict for the winter and other sports.
KXLY is asking or saying that DOH just released numbers of variants in the state today. There were 10 Omicron cases, and she's looking for clarification as to, are the 3 identified today included in that?
They are not. That 3 that were just identified were done within the last hour. Thanks to our lab partners at the University of Washington, we were able to identify 3 additional genotypes this afternoon. So, it's not like we're going to update these numbers every hour, you guys, to be really clear. We'll probably update them once a week, but as part of this investigation, we're going to ask for updates from our genotyping staff daily.
And
All right,
Dr.
There are, by the way, there are 100 S dropouts waiting to be genotyped.
So we have 8 minutes left. There's some, this is from KNKX. There's some reporting that Omicron is spreading faster in Washington than in other states. Any indications yet as to why?
Yeah, I'm not sure that that's entirely true. I say that because Washington is one of the leading states for genotyping. We always have been. Like I said earlier, we detected the first case of COVID in the United States, not because it was probably here first, but because we have very sophisticated surveillance system that was looking for it. Clearly, as we look at the genotype from that very first case of COVID, it wasn't the first case in the United States. It was just not detected anyplace else as early as here. The same thing is going on in Washington right now. You guys, we are the number 6 state for doing a percentage of all our positive cases for genotyping. And our sheer numbers are higher than most states also. But in addition, when we first heard about Omicron, it's been about 2 weeks now, I asked our labs around the state that were doing tests that would identify an S dropout to send every single one of those to us. So in a sense, we're really selectively looking very hard in Washington state for it, much more than some states that aren't looking at S dropouts. So you're seeing more coming out of our state because our surveillance system is pretty on the ball.
As a follow-up to that S dropout, John from KUOW is asking, does an S dropout mean the case is in fact Omicron? What else could it indicate?
Yeah, so one thing that we call these when we identify an S dropout, so that say there's 100 of them, we call those probable Omicron cases. It actually takes a genotype, which can take anywhere from a couple days to a week to do the full genotype sequencing. Once they are genotyped and that genotype matches Omicron, then we call it a confirmed case of Omicron. So unfortunately, not all the Omicrons have S dropout. A small percentage of these are still having the persistence of this S marker in the test. And there are other variants, not that we see them right now, like Alpha variant that also has an S dropout. So we can't be 100% certain, and that's why we're calling these probable cases, and then we do the genotyping.
And Dr. Lindquist, are you able to say at this point how much more contagious Omicron is compared to Delta?
I can't we don't have enough experience here in Washington to answer that intelligently here in Washington. We are seeing reports from South Africa in particular and other countries where they're saying that it is probably about 30% more infectious than Delta, but I can't confirm that here in Washington. It does seem like a pretty large percentage. And again, as we get the numbers clarified, a pretty large percentage of those involved in the wrestling events that have become infected. So I am cautiously predicting that this will be more infectious.
Thank you.
KNKX is asking, the State Hospital Association said this week that they are at capacity, not due to COVID, but from other patients. But are we looking at a hospitalization wave similar to what we saw with Delta?
Yeah, it's unknown. It's a great question. I mean, this is what keeps me up at night. Our hospitals are full, as you say, not just from COVID. There's a lot of other factors that go into this. But it's at the most inopportune time to have full hospital systems with a new variant that we are not clear if it is going to be more severe. Fortunately, the preliminary data we're seeing from both around the United States and around the world is it tends to be less hospitalizations, but let's be honest, Washington is unique. Our population makeup is unique. The number of patients with underlying conditions is unique in Washington. And our vaccine or natural infection percentages are very different than some of the places that are predicting this for the rest of the world. So until we actually see that data coming out of Washington over the next couple of weeks, so probably a couple of weeks, I'm not sure we're going to have a good sense of this yet.
All right, we've got 3 minutes left. If you have any final questions, otherwise we will wrap promptly at 1.
I just popped it in the chat, but I'll just say it. So at the start, you said that wrestling tournaments lead to outbreaks. Was that based on some evidence from some prior disease, or are you talking about COVID in particular? And if you have any more specifics you can share, please do.
Yeah, no, I'm talking about, we had a very large outbreak of pertussis in the wrestling community here in Washington State in 2017. And as you can imagine, just the ability to transmit an airborne infection in a wrestling match is just higher than most events. And on top of this, you put people in a crowded indoor space, bleachers, and where mask wearing is not optimal. This is a perfect situation for transmission and outbreaks.
Let's take one last question. If anyone else would like to chime in, otherwise we will wrap. All right, Dr. Lindquist, any final words?
No, just stay tuned, you guys. This is an early ongoing investigation. I have a sense it's going to be very large, and I have a sense that Omicron is going to play a big role in this. So stay tuned as we get more details, and we will certainly, through our media channels, alert you guys to what's going on.